I feel like this is a common theme that we're hearing in all hormones right now. If you choose to go on a medication, that doesn't give you a free pass from lifestyle. Am I hearing that right from you through the lens of thyroid?
1,000,000%, 1,000,000%, because I've even found myself. So on my podcast, obviously I'm talking a lot about thyroid and this medication versus that medication and what to do to support it, blah, blah, blah. And even my patients, they've almost been trained to a point to think that, okay, we replace thyroid, replace hormones, it's all okay. So now I've shifted over the last year or so.
Yeah.
And I'm really pounding the point home, driving the point home that, but you also have to do all this lifestyle stuff.
Yeah.
Because if you're not sleeping and you're eating like garbage and you're drinking alcohol 3-4 times a week because you just need your glass of wine at the end of the day, it's not going to work. I don't care. I can throw on more hormones, more thyroid medication. It's not going to work. And ultimately you're still going to say, hey, I still have all of these symptoms. Well, yeah, duh. Because over here, your lifestyle is a disaster.
Yeah.
So it doesn't matter. The hormones aren't going to work. They're not going to work unless you change. So I'm so happy you said that, because I've really been working hard at driving that point home to my audience as well and my patients that, listen, there are tools that we can use. Absolutely. Hormone replacement is a beautiful tool, but you still have to change your life over here.
Yeah. I can't tell you when I had I can't tell you enough. Like when I had a clinic, I had so many women coming in with thyroid problems. And the chronic statement they would give me is, my TSH was low or my TSH was really high. So my doctor put me on a medication and I don't feel any better. And I went back to the doctor and he or she said, well, your numbers are normal. So can you talk a little bit about that scenario and how lab work and why TSH is not the only thing we should be looking at when we're measuring the thyroid?
Yes. Oh, it's so classic. You just nailed it.
So classic. I know. It's crazy. Yeah.
Woman walks into her PCP and says, doc, I'm gaining weight. I can't lose weight. I'm so damn tired throughout the day. I'm dragging myself through the day. I'm losing some hair. My skin's really super dry and I can't poop every day. And he goes, okay, well, here's a pill. And that's Synthroid. That's going to be T4. So you're going to get Levo or you're going to get Synthroid, and that is T4 only. And then just like you said, ultimately they'll be like, why am I even on this medication? It's not doing anything. I'm not feeling better. I haven't lost any weight. I'm just going to go off of it. Okay, well, it's not that you don't need thyroid support or thyroid hormone replacement. You need the right kind for you.
Yes.
In the right combination, in the right dose. Yes. So, and here's the other problem. Yes, just like you said, your average run-of-the-mill conventional doctor will only test TSH. That's thyroid stimulating hormone.
Why? That is it's archaic.
Yeah, it really is. So interestingly enough, I gave a talk to a group of integrative wellness physicians a couple of years ago. And the talk was all centered around, here's what we need to test beyond TSH. And why are you guys in the Synthroid box? Meaning you only prescribe T4, right? And I gave the example even of, if somebody comes in and you give them an antidepressant and an antidepressant doesn't work, you'll give them another one. And if that one doesn't work, you'll give them another one. If that one doesn't work, you'll stack a benzo on it and give them a sleeping pill. But you won't do more than one thyroid medication. Doc raises his hand and goes, that's all we've learned.
I was just going to say they don't know. And so I just want to make a point on that. That is such a good story, because what I'm learning from just interviewing so many women specifically that were entrenched in the medical system and now are looking at our health through a more functional lens, is they say that exact thing. They have only been trained one way, and they haven't been trained on lifestyle. They don't know lifestyle. So, but yet we live in a culture that has our medical doctor on a pedestal. And so anything they say, we believe as gospel, and they've been trained to not say, I don't know. So with that in mind, is there a way to talk on this one topic of thyroid and TSH? Is there a way to talk to our doctor and say, could you look at other things? Could you refer me to somebody that would know? Like, is there any way to help change that broken model?
Yes and no. So, number one, I tell people you have to go in to your doctor with a bulleted list of your symptoms. Don't write a book, don't write a story. They don't have time to read 5
Right.
paragraphs. Bullet list your symptoms. And then over here, I want you to put the tests that you want to have done. Now, a full thyroid panel is TSH, free T4, free T3. So we want to look at the free means the unbound forms of that particular thyroid hormone. T3 is active, T4 is inactive. So we want to look at both of those. We want to look at reverse T3. That's your anti-thyroid hormone. And then we want to look for the 2 antibodies for Hashimoto's, TPO, thyroid peroxidase, and thyroglobulin, TG. And if you go in with that list and you hand that to your doctor and you say, I would really like to thoroughly test my thyroid because here are all my symptoms and they look pretty much like thyroid related to me. If your doctor says no to testing, it's time to get a new doctor.